Dr. Reddy, so happy to see you. I always learn so much every time you're on the show. So let's talk with the subject that might be on a lot of people's minds this month, ovarian cancer. How common is it and who is at risk?
Yeah, so luckily, ovarian cancer is not that common. If you look it up, they actually consider it rare. It's about the fifth cancer death for women, meaning there are four other cancers that kill more women than ovarian cancer. The estimated lifetime risk is about 1 in 78. And people who are at risk are going to be really anyone that's a woman, but people that have a family history of ovarian cancer or related malignancies, like people that carry certain of the BRCA or the BRCA mutations, they're at higher risk. People that are older, this is actually a disease we see in women in their 60s and 70s. We do see it in some younger women, but in general, it's a postmenopausal cancer, mainly women in their 60s and 70s. Women that are overweight are at slightly higher risk, and certain other lifestyle things can affect your risk. But there's one of the frustrating things about ovarian cancer is that there are very few symptoms and very little screening that can be done.
Well, that's was going to be my next question. And I was going to say, too, I'm glad that you brought that up about the BRCA gene because I didn't realize that. I'm adopted. I don't know a lot about my family history, but if you take any of the genome tests that they have now, I'm sure your doctor can do it too. You can find out if you have that gene. So I don't have that. So that's one for the pro side for me, for me, I guess. But good to know. All right, let's talk about the symptoms and how this cancer can be not easily detected.
Yeah, this is one of the frustrating things about ovarian cancer is very often there are no or incredibly subtle symptoms when it's at an early stage. So the one of the saddest things about ovarian cancer is we tend to diagnose it when it's in a pretty late stage, and that's when any cancer is the hardest to treat. So the symptoms of ovarian cancer can be a pressure in the pelvis or abdomen. You can have changes in your digestion or bowels. You can have perhaps like feeling like you can't eat as much. You feel full easily. So really anything that feels different or off in your pelvis or abdomen may be something to pay attention to if you, especially if you have risk factors, and bring that to your doctor's attention. Tell them what you're worried about. I know when patients come to me with any symptom that has any inkling or any concern of ovarian cancer, what I'll do is order a pelvic ultrasound. While it's not a perfect test, it's a pretty good one to give us peace of mind.
Last but not least, I just turned 40, so I get a whole new bevy of screenings I get to look forward to. But tell women that are watching what we need to be looking out for gynecologically to make sure we're up to date.
Yeah, great question. So, as a gynecologist, the things that we make it a point to remind patients of are going to be mammograms for breast cancer. And we usually start those screenings depending on risk factors, but normally around 40. The other thing most women are aware of is cervical cancer screening, which is the pap smear, including HPV testing. And that obviously we do early on. We start at 21. But that is a cancer that we have almost conquered in America through pap smear screenings and now through the HPV vaccine. So mammograms and pap smears are the established screening tests that we have. For cancers like uterine cancer, which is another gynecologic cancer, there actually is no screening, but uterine cancer tends to show up again a little bit later in life, usually in the 50s and beyond, with abnormal bleeding, specifically post-menopausal bleeding. So I tell my patients once they're in menopause and haven't had a period in a year, if you ever see any spotting, any kind of bleeding, make sure you let us know because then we can look for uterine cancer. And it is Ovarian Cancer Awareness Month, so that's what we're talking about. And unfortunately, for low risk or all women, there is no established screening, which is why we encourage women to stay on top of these symptoms. For women at higher risk, we may do screening tests like ultrasounds, but again, that's not for everybody, and that's not a perfect thing either. But the main screenings to look for are mammograms and pap smears.
All right, Dr. Reddy, thank you. You've given me a lot to think about. I hope a lot for our viewers to be aware of. Thank you so much.
Take care.